Mr. Chairman, members of the Health and Government Operations Committee, it's always good to be here. I know that there is a avergence to having any task bills this year, but all this bill does is say go back to the task force that in 1998 asked you to look at this issue, and it's 57, I believe, recommendations came out of that task force. And I've provided each of you a copy of the list of recommendations that the previous task force came up with, how to stop women from being raped by professional psychological counselors, the therapists, and such. So you had a task force, you set it up, they said, here's what you need to do. We're not doing any of these 57 things. And so it would be nice if you just looked at this and said, you know, this might stop the problem that's continuing to go on, and it is going on nationally. It's going on here. Since we had the hearings last year on Lynette's law, it's continued to happen. It's worse. And even the situation that was in Lynette's law, the man who they told you they took his license and he'd never practice again is practicing, and he's seeing people here in Maryland. He was doing it without a license, and they're trying now to address that. There were other people who were recently caught with writing less medications for their clients who don't have licenses to write the medications, and so the board, decided that they would keep that confidential from everybody and take a vote to not publish it, even though they're supposed to. So this is some very straightforward, easy recommendations that it was a thoroughly done. And I just ask, go back and look at what was done in 1998, what they asked you to do, and implement some of those and help. It won't cost anything because it's all done. So if we could implement some of them, it would really go far to protecting women and men who are the victims of sexual exploitation by professionals, and it would teach the professionals how to handle those situations, not to become involved in them. And to look, the bottom line is you cannot give consent to somebody who is treating you psychologically. If you have sex with somebody who is treating you as a doctor, it's rape. You can't give consent, it's rape. Help stop that. Thank you very much.
Any questions or response to this bill? Thank you very much.
Thank you.
Let's bring up Heather Sinclair.
Good afternoon. I have to tell you, it's so much more pleasant in here than in Judiciary. Good afternoon, members of HGO. My name is Heather Sinclair, and you've heard my testimony before you before last year for HB56. And I first want to start, and I want to thank each and every single one of you for voting for HB56. It was passed into law last year, and we are now requiring criminal background checks for mental health professionals. I also want to thank you for your House vote for passing out HB60. That was criminalization for sexual exploitations by mental health professionals that did die in the Senate last year. We have brought that back as HB33 this year, and that bill is currently dying in Judiciary as we speak. Now, I first want to say Delegate Schmigel did a wonderful job of explaining what this task force does. I have actually talked to the vice chair of that task force, who handed me a very large box of information after the legislation failed last year. Just on a personal note, when it failed last year, I took it very personally, and I felt like that I had outed my personal tragedy in front of everybody to see with no results. So after that, I had a little conversation with God, and I was basically screaming and crying to him and asking him to give this to somebody who can fight for this, because obviously I cannot fight for this. I'm not strong enough. And I got a call from the vice chair of that task force. She plucked me out of an interview that I had done, and she handed me all this information, and that's why we were bringing this back in front of you to put forth those recommendations. And as I drove away from her house getting that box of information, I just kind of looked up and I said, that's not what I meant. But obviously I am here again this year because there's a reason that I'm supposed to be here. And I just want to share with you very quickly, this is a letter from Senator Leonard Tattlebaum to Dr. Wasserman, who was the Secretary of Health in 1998. And in his paragraph, he puts in quotes, "Clients who have been sexually exploited by a mental health professional need a variety of supports, one of which is information on common responses to sexual exploitation and possible actions one may take to seek redress. Moreover, clients so victimized may lack confidence in licensing boards, which are sometimes perceived as protecting the professionals and not the public's interest. By providing the educational brochure to the complainant, licensing boards not only may offer needed information, but they may also engender increased confidence in licensing board complaint process." And I have a copy of that, which was in the information from the senator. This is what they're talking about. This was a brochure on sexual exploitation that what came out of that task force. And this was in every public health facility and every public library. And it very specifically details the symptoms of sexual exploitation, and in the back where people could get help if they were sexually exploited. And unfortunately, none of those places are in existence today in Maryland. There is no help when this happens to someone. And I would say the best place would be a rape crisis center, but unfortunately a lot of people that have come to me have lost complete trust in a mental health professional after this has happened, so they are very unlikely to go and seek help from another mental health professional. I also have copies of what came out of the task force, Maryland Task Force to Study Health Professional Client Sexual Exploitation, Building Understanding, and Facilitating Change. This is all the research that we already have in this box of information. Some of it may be in the records that were within the task force, I'm not sure. I just got the original copies from them. And talking about the recommendations, there was a lot of good recommendations that came out of that task force, and they studied this for 3 years. This was not a small project. And these people who were on the task force, they are doctors, they are lawyers, they were top-level professionals that studied this. And I want to read recommendation number 48. Says the task force recommends that the legislature enact a law or laws to make criminal A, sexual acts and sexual contact by means of therapeutic deception by a health professional, B, the treatment or examination of a patient by a health professional for other than a bona fide health care purposes, or in a manner substantially inconsistent with reasonable health care practices, and C, sexual acts and sexual contact during psychotherapy if the actor is a psychotherapist and the victim is a client of the psychotherapist. Consent by the client to a sexual act or contact shall not be a defense in such cases. Now, this was recommended by professionals a long time ago. There was also another task force in 2008 that recommended the same thing. And I believe, had this already been a crime, even if this had happened to me, I would have had resources, because in the 27 states that have made this a crime, all of a sudden we have lawyers that pop up and specialize for this, especially in California. These are considered million-dollar cases. And it's not just about the money, it's about what happens to the person after their health insurance only covers a professional in a certain building. And then they have to pay out of pocket. In my case, I fell through the cracks where I did have good health insurance, but it would only pay for a professional in that same building, and I did not want to return to that building. So I called the YWCA to see if they could help me, and they said, sure, we can help you, but you have health insurance. You would have to pay $260 an hour to see one of our professionals. So that is what we're facing here by not criminalizing, and I absolutely support this task force. I do think at this point, with the status of HB33 sitting in a drawer, that it's almost like we're going in circles here, because without criminalizing this, that is the biggest deterrent for this behavior, is to criminalize this. And once you criminalize this, the victims then can get services through victim services through the state, just like rape and sexual assault victims. So I absolutely support this task force, and I hope to sit on the task force. I have sent a video to each and every single one of your emails, a video that I produced called Exploitation Nation, and you had a question during 841's hearing. You asked about if we have any stats for state hoppers, and unfortunately we don't, because I'm the only one looking into this, and I have been able to prove in that video that we do have state hoppers. Public Citizen has uncovered that there's around about 50,000 incomplete records in the National Practitioner Data Bank as we speak. So my video does show state hopping going on. It does show that the boards are willing to give a consideration to a license of a convicted child molester. And there were several cases where they were allowed to surrender their license rather than go through criminal prosecution. And I think I have proven that very well. And unfortunately, I don't have an association behind me. I don't have lawyers and doctors. It's just me, and it's just volunteers who have spent 2 years of their time. And it takes a lot of time to go in through these records. Right now, we have legislation in West Virginia. We have legislation in Delaware, and we have legislation in Pennsylvania. The biggest problem is most of these states do not require criminal background checks for their professionals. We are introducing that in West Virginia. And the other problem is their disciplinary actions are not listed publicly. So I am going to different states to try to get it listed publicly so the public is aware of their background. And to try to implement the criminal background checks, because we have a lot of state hopping with our neighboring states. So I would ask this committee for a favorable report. Thank you.
Are there any questions? Delegate Nathan Pulliam.
I just wanted to commend you for staying focused.
Thank
Okay,
you.
that you have not let down. I remember your story.
Thank you.
And my hat goes off to you for the work that you've been doing.
Thank you. You're actually one of the reasons that I'm still fighting for this. I saw you ask about me during 841's hearing, and I appreciate that. It's been really hard, and it's people like you that keep me fighting for this. Thank you.
This up, but reading this report from 1998, and then you said there was another task force in 2008.
Yes.
This is a very good report. I'm not sure which things in it we've done and not done after 20 years, but I don't see what another task force is going to do. It seems like your problem is what you said in your very first statement, is the Judiciary Committee not passing the bills. I mean, you read exactly what we want to do. So having another task force reaffirm that is not going to change the Judiciary Committee.
Right.
So I'm not sure. It will just give you more time, and I guess I think we need to put pressure. If this committee thinks that we need to do these things, maybe we should put more pressure on getting the bill passed than do another task force to tell you to do the same thing again.
Yeah, I absolutely agree.
So, I
with
mean,
you.
I know your frustration, but I don't
Right.
think that this task force is going to help you get there.
Delegate Schmiegel, we can't do that.
Maybe we could get the bill next year reassigned to the HGO committee instead of...
I
Mr.
absolutely
Chair,
agree
maybe
with
we could
that.
get some of these bills assigned to the HGO committee for mental health reasons and not to the Judiciary Committee.
That
Right.
may be a good strategy.
Yeah, I absolutely agree with that.
But thank you.
Thank you. Thank you for bringing that up. I think when I started to learn about the brochure that had been out, and DHMH actually had a section on their website with a video that talked about what happens to patients after this. And this is very severe. I've now known 2 people that have committed suicide after this. And I myself have struggled with it because it is such a silent epidemic. People are very uncomfortable when you come out and you talk about this. They don't want to hear about this. But I think we should talk about this. This should be an open dialogue because, many of you have children, and you need to realize that camp counselors may have not passed background checks, and they may have a long history of hopping from other states. So this is a very serious issue that needs to, it seems like it's very silent, and I do appreciate that. And I agree with you that it seems like we're kind of going around in circles. I'm just trying as hard as I can to try to bring this so that we can have a conjoined effort, because right now it's just me and the delegate who's bringing this, and we need a lot of people on our side. So I appreciate the question.
Okay, are there any additional questions? Thank you, Ms. Sinclair, for your testimony and your advocacy. We do appreciate it. That's okay. We understand that. We thank you for your good work, Delegate Schmiegel. Let's turn